Well, good to have you with us here on the Wednesday edition of the South African Morning. I'm Gareth Edwards. Now, there does seem to be a lot of challenges at Gauteng hospitals, from the delayed rebuilding and refurbishing of Charlotte Maxeke Hospital, that's the academic hospital, of course, here in Johannesburg, to Chris Hani Baragwanath having bread shortages. The basics just aren't right. Well, earlier I heard from the National Council of Provinces. They had visited the hospitals and confirmed they are in a dismal state. But what do we do with that? Everyone knows that they're in a dismal state. But what do we do? Well, let's unpack that with the president of the Young Nurses Indaba Trade Union. Always good to speak to Lerato Mthunzi on eNCA. Lerato, good morning. And I want to correct myself. I'm saying challenges, and I don't think that's quite fair. This isn't challenges. This is near impossible, these conditions, isn't it?
No, definitely. I think you've nicked it. It's almost like we are in a movie, and it's a horror movie. Here we are with the issue of Charlotte Maxeke having a hospital that our response was supposed to have been that hospital is up and running within a couple of months, and we are almost to the end of the year and nothing has actually happened. And we are getting reports, and what we read even on the media, what we hear on our members on the ground, that the demolition, the level of theft and thuggery that is happening within the space, whilst insecurity, it's absolutely shocking. It's absolutely shocking. We are in a real crisis.
It is. And then we have interviews with politicians who tell us that it's horrifying and it's sad to see professionals, professional nurses, professional doctors, medical experts leaving for other countries, looking for other job opportunities. But when you're working in conditions like this, we can't really blame those who choose to rather go and take their expertise and their skills elsewhere. That's the other issue we're dealing with, aren't we? It's a brain drain.
It's an issue of brain drain, but I think the worst situation that we find ourselves today, particularly in Gauteng, is when the Department of Health is letting go of more than 8,000 healthcare workers post the pandemic, when we have a problem of shortage. It's not only those who volunteer to leave, but it's when the departments say we do not have vacant funded posts. Yes, we've got shortage. Yes, we are giving substandard care, but we still need to let go of more so that those who remain working are not coping. They are overstretched, they are burnout. So it's brain drain, it's also burnout at the same time, and it just tells you we are in a worse state. And we thought coming out of the pandemic we would have taken some lessons and we'd be in a better state, and we're not.
And to add to that even further, I just feel like I'm adding fuel to the fire, but I feel like I need to throw this to you and get your reaction. And then we're taking 50 million rand and we're paying Cuban doctors.
Look, when that happened, we knew that was the most bizarre move. When you've got doctors and nurses that we've trained with taxpayers' money, and they are literally unemployed and pushed to the very brain drain that we spoke about, where they have got to look for opportunities either in private sector or even elsewhere in other countries where they are well sought out of. But now when you are sitting with a challenge of a disorganized system, or it's not even maladministration, because you have to have some form of foresight. You've got to know that this is why I'm training this number of nurses or this number of doctors, and I've got a need and I need to be able to plan to place them, and you have not done that. But you actually get Cuban doctors who come in and struggle for the better part of the pandemic to just communicate with our people, and they become a burden rather than an alleviation into the healthcare system, and you pay them exorbitant amounts of money. And even today, we still have got some of those Cuban doctors in our facilities, and it's just not acceptable.
Lerato, take me into the day of a nurse or a doctor, a medical expert. I don't want to try and bracket any expert into a title. At these two hospitals, Chris Hani Baragwanath and Charlotte Maxeke as well. Just how difficult is it to do the very basics of their job? And the basics of their job, I'm sure you'll agree, is to keep people alive. Are they even able to do that? Take me into the day of a nurse. What does it look like?
You know, I normally describe it to say you wake up every morning and you know you're going to be an accomplice of murder. it sounds worse, like as I'm putting it, but you are going there because you are only human. You've got two hands. And if you are in that maternity unit and 5 women are bearing down at the same time, you can only assist one. The rest of the 4 is going to be malpractice, there's going to potentially be death. You're going to work that is not just draining you psychologically, but you are feeling as if you are going there to actually cause harm than good. It's, the 3 major problems that we always hammer on. Human resources, we need more hands on deck. Those nurses that the department is threatening to let go, we cannot afford to let go even one of them. The second thing, material resources, we struggle on a day because of the red tape. I mean, the issue of bread, the issue of just having those patients, some people are reducing it to say it's bread. It's actually not just bread. For patients who have medication, they must have eaten something in their stomach. For us to administer any type of drugs on them, for them to recuperate, we need them to be, to have eaten something. So to be very honest, when you find yourself that sometimes you must provide, we must sit in a meeting and say, colleagues, how much do we have in your pocket? Let's club together so that our patients can be able to take, their next round of meds. It's just bad. You go there and you can do as much as you can improvise as much as you can, but you are simply not doing enough. Because when you get to management is supposed to say, look, our hands are tight, there is no budget, or we are still waiting for the central office to approve this, or we simply do not have. What must we do? So when you are there in the clinic, in the hospital, you are left in your own means and you must improvise. So it's really a daunting and a very emotionally taxing experience when you go to work and you are trying to help the patients. But at the same time, the community and the patients and their escorts are not going to make it easy because they're seeing you in the front line. They expect you to have your story and your ducks in a row, and you don't have, and you are going to get a serious attack from the community you serve because they actually don't understand that the government that we voted and we've put in power simply does not prioritize healthcare.
Lerato, I've been seeing reports as well of nurses and doctors even bringing food in themselves out of their own pocket to try and give to patients. Exactly because you say that medication, more often than not, has to be taken with some kind of food. And that's the level we're at now. I just want to leave this with you before I say goodbye to you. Just very briefly, we can't fix everything. I know we can't. You know we can't. But if government is listening now, and I'm sure they are, pick one thing for me today as the union that you want someone in authority to go somewhere. You tell me where and do what as a last question to you.
Just one thing, and this would be a deep, heartfelt plea. Can we get more people? Can we get those nurses and doctors that are home or at risk of losing their jobs to be in those hospitals? Can we get those vacant funded posts? Can we get contracts extended? Can we get more hands on deck? All we want to do is to save lives, and I think that's as simple as that.
Why is that so difficult? All you want to do is save lives. It should be very, very easy to do. At least you have the resources. Lerato Mthunzi, thank you very much. It's always a pleasure to have you on, but you can just hear the frustration, the agony, and even the sadness from the young nurses in Indaba trade union as well, just simply wanting to go and do what they're trained to do, Tumza. And it's a simple thing of being able to provide a meal before someone takes medication, before someone goes for surgery, and they're not even able to do that. And that image of 5 women all giving birth at the same time, and you've got one nurse, 5 women giving birth at the same time. There's a term they use, triage. How do you begin to even choose? Because that's what Lerato is saying.
Yeah.
At that moment in time, 5 women giving birth, you've got to choose. You can't help everybody, and that's the state we're in. So we're going to try and pick up on a lot of what Lerato had to say there with hopefully those in power, and hopefully try and find some kind of answer and way forward.
And you know what, Gareth, I think this conversation is so important. We often hear, South Africans complaining about the low staff morale from nurses, but we need to delve into why there's such a low staff morale, because of the challenges that clearly they're going through psychologically, professionally, and that needs to be delved into because we do need them.
No, of course we need them. Absolutely, quite right. So we'll follow up on a lot of what Lerato had to say.